Okay, so we're going to start with a new patient who has medial knee pain, and then we're going to show you how to diagnose that and treat it. So um, basically, we take the information from their intake form right here. I'm going to film that. And we see that he did mark knee pain, and it's to the right side. So, and I just asked the patient, so what brings you in today?
I just had a question about my knees. I was working out one day and must have done something. So the inner part of my right knee kind of hurts, like right
Can you
here.
stand up and point exactly where
So
it hurts?
in this area.
Okay, so more on the inside?
It's like on the inside right here.
Okay. Right there, so you mark there. So how long has it been going on?
It's been going on for maybe about a year. So I gotta be careful when I work out. I do less cardio where there's a lot of impact, and I do mostly a lot of weight training now. And then I do bicycling. That seems to be helping out.
Okay, so make sure you type in right here in the notes detailed of how he injured his knee.
So like long distance walking or running, that's just almost impossible for me right now.
Okay, all right. So basically, when the pain does come, how would you rate it on a scale of 1 to 10, with 10 being the worst pain imaginable?
When the pain comes, I'd probably call it like maybe a 7 or 8.
Okay. And is it sharp or dull pain?
It's sharp and then it dulls out.
Do you ever get pain when you're sitting?
No.
Okay.
Look, I'm fine right now.
Okay, so basically, this patient is presenting with medial knee pain, basically when he's on his feet, walking or running, and no pain when he's sitting. So, again, just from the history, we can pretty much figure out that there's something about him being on his feet causing the medial knee pain. So, what we have to think more is it the problem with the knee itself, or is it the biomechanics of the feet? So I'm going to show you how we're going to do a foot exam, and we're going to use the Posture Pro program to do that. And it's something that I kind of invented myself, of using the Posture Pro in this way to examine the feet. Okay, so what we want to do, we want to add a record. Okay, and I'll show you how we're going to photograph the feet for the evaluation. Right, so you're going to take your shoes and socks off. So, and you always want to make sure that they roll their pants up to above their knee. Okay? So it doesn't fall down, because you're going to be standing up. Both sides. And I want you to switch places. I want you to face the doorway. Like I said, roll it up so it's going to stay up by itself. Okay, now face the door. Watch your head. Okay. So, is that your normal stance? I want you to march up like 10 times in place. Close your eyes. Okay, stop. Okay, so this will give you a baseline view. I want you to picture, here, give me that. So here, we want the view to be about like this, okay? Actually, want to be able to see at least his SI joints. And then we picture just like this. Okay. Alright, that's good. Alright, now go ahead and have a seat, and we'll get your results up. So basically we're going to PA view of his SIs and his entire feet. And I'm mainly concerned about the way his pronation or overpronation is. And we're going to find that out now. So again, we open up his file, posture analysis, import AP, drag it to the bottom, bring it up. And here, what you can do is use RQA for the left, and then get the top of the Achilles tendon, and just draw 4 lines and outline it. You know what, let's use A to P, because you get more lines. 1, 2, 3, 4. Okay? So don't use this RQA. In fact, I'm going to erase this. Okay. Now, for the right one, let's use get posture number. And again, these buttons were not made for the foot exam. This is my little adaptation, something I figured out to the program. Okay. Now, after you outline the Achilles tendon, press save. Okay, and then view exam, and then scroll down, and then you show this to the patient. Well, you see the reason why that you're getting the pain in the inside of the knee is because, as you could see, which foot do you think is rolling in more, the right or left, from what you can see?
The right?
Yes. Because see how you can count 1, 2, I could see 4 of your toes on this side. And this side, I could only see 3. And you can see this is bowing more. All right. So when you're walking, let's view his feet. What's happening is when you're walking, your right foot is turning in more. It's called overpronation. And what do you think it's going to do to the knee here? It's going to put more strain, right? So that's why when you're walking or running, you're like this. Can you pull your pants up again? Both sides. And I'm going to show him how the arch is dropping. This is called the navicular drop test, okay? So we got the navicular bone right here. We got the process right here. Now put your finger underneath. I want you to stand up. So when he's sitting down, it's not weight bearing. So I can put my fingers under there and I don't feel any pressure. Stand up. Okay, now, do you feel the pressure on my feet, Who?
Yeah.
Or your pressure on my finger? So what's happening, the navicular arch here is dropping and is causing pressure on my foot. And when this is dropping in, look at the knee, the medial collateral ligament is taking the brunt of the force. So it's getting strained here. Okay, now sit down. And let's check the left one. Okay, go stand up. This one's not as much, right?
Yeah.
A little, but not as much. So this is biomechanically more stable than this side. Okay. Now, the way we fix this is we have to support this arch with a custom-made orthotic, and I'll show you how we make those. Okay. So we want to sit down. All right. So basically, at this point, you show them the evidence right here. Your right foot is rolling in, and the only way you can fix that is support the arch, okay? And that way, when you're walking, the arch isn't caving in, causing your knee to bend in and cause strain, okay? So we want to put an arch in here to support that, orthotics, and that way when you exercise, it'll keep your knee in alignment and keep your whole body in its normal biomechanical position. Make sense? Okay. Right. So your orthotic, there's a casting fee of $32. The actual orthotic itself, if you want one for walking shoes or a first pair, it's $132. If you want a second pair, it's $110. Okay. So we'll go ahead and cast you up, and you decide what type of pair you want. Okay. Now here's your orthotic order form, and we're going to show you how to fill it out later. Okay. But for now, we want to cast him, so we open this up. And we put this under the foot. So the knee has to be about a 90-degree angle. All right. And what you're going to do, you're just going to stand up. Okay, go ahead and stand up. Okay, and then we just push his feet in like this. Don't put over pressure right here, just the pressure of standing. Now sit down. Make sure his knee's in alignment, and take this out. Okay, and we can see there's a pretty good arch there. Okay. Now for for this side, I want you to bring this up, and this is at a 90 degree. Go ahead and stand up. Push the toes in. Okay, and then you want to sit down and take the foot out. And we can see there's less arch here because it's overpronating, it's getting flatter. Okay? So, okay, it'll take about 4 to 5 days for your orthotics to come in, and on your way out you can tell the receptionist what type you want. Okay? Now, when we're making the orthotic, okay, we see the left orthotic there. We could see 3 toes, right? So we want to put a medial post right here. We put 3. Okay? On the right side, we put 4. Okay? Because in the medial side, we want to raise the foot because overpronating, you want to compensate like this. And so I just count the toes. How many are toes? That's how we put the angle. The medial rear foot post for overpronation. Okay? Put your name. The right side's overpronated right here. Left side's pretty normal. Achilles tendon is bowing in on both sides. And that's about it. Okay? And that's how we diagnose, cast, and prescribe for foot orthotics. And then also you got to put, if they want the semi-rigid is for walking shoes, or the sports orthotics for sporting activities. Okay, that's it. You can turn it off.